heart disease or having a heart attack. Well, joining us now is Dr. Salvador Salvador from Las Palmas Medical Center. Dr. Salvador, thanks so much for joining us today. What exactly is endometriosis?
So yes, good morning. Endometriosis is a disorder, a disease where the endometrial glands implant outside of the uterus. The most common places that endometriosis implants are the ovaries, fallopian tubes, the uterus, the bladder, and sometimes the intestines. Locally, there in the pelvis, wreaking havoc on these tissues. It's primarily an inflammatory type response, and these glands that are outside the uterus are predisposed to the hormonal imbalances and the hormonal factors like the endometrium. An analogy is these tissues also have a menstrual cycle. They're thickened, they bleed, and it goes along with the menstrual cycle.
Well, what are the signs, some of the signs that we should be looking for, and the symptoms as well?
So some of the signs are chronic pelvic pain, specifically cyclical chronic pelvic pain that go along with the menstrual cycle, painful intercourse, and if this tissue implants on the bladder, dysuria or painful urination. If it implants in the intestine, you may have painful defecation when you have a bowel movement, when you use the bathroom. It's one of the major causes of chronic pelvic pain and infertility in women.
What treatment options are available for those diagnosed with endometriosis?
So some of the treatment options for endometriosis, like any chronic disease, we usually start off conservatively and then we move to more radical approaches such as surgery. Because it is a chronic inflammation or chronic inflammatory process, we start off with NSAIDs, nonsteroidals, anti-inflammatory drugs such as ibuprofen, Aleve, naproxen. And then we also, one of the causes is also hormonal imbalance. So we start with birth control pills, either cyclical and or continuous, in hopes of reducing the inflammation and also bringing back that hormonal balance to the menstrual cycle of the patient.
Well, it is estimated that 176 million women throughout the world are living with endometriosis, and a study found that women with endometriosis saw a 23% increased risk for cardiovascular disease. So can you explain how endometriosis affects the heart?
Yes, so that was a very interesting study. It was the BMC Public Health Biomed Central meta-analysis. So these meta-analysis studies bring together a lot of data and then produce an outcome or a conclusion. And so they concluded that endometriosis causes cardiovascular disease primarily by three major factors: chronic inflammation, which affect many end organs, especially the heart, muscle damage, vessel damage. There's vessel dysfunction or the lining of the coronaries. There's stiffness of the vessels, and they also give rise to atherosclerotic plaques, increasing the risk of cardiovascular disease, hypertension. And then there's the hormonal imbalance, primarily estrogen, which is the fuel that feeds the fire in endometriosis. This estrogen also causes vessel dysfunction, and then you also have immune dysfunction as a result. Interestingly, with respect to my field, it also increases the chance of ovarian cancer.
Very interesting. Doctor, thank you so much for your time today.
Yes, thank you very much for having me.